Renal pharmacology are much known for the NCLEX in the nursing school. Pharmacology, test 11. 15 questions, 12 medication with rational mnemonics, key facts. Let's get to it. The first question, as you can see, is just testing your knowledge about what medication you need to hold and you need to give to the patient when they're going for dialysis. This is what nursing school NCLEX will ask you on pharmacology. Which medication should the nurse hold until after dialysis? Select or apply. A nurse is preparing morning medication for a client on hemodialysis, right? The client is undergoing hemodialysis. Which medication should you hold until after dialysis? There's a concept regarding these medications. The first thing you should know, any medication that can be cleared by the kidney during dialysis, you got to get rid of it. Anything that is going to cause hypotension, you should avoid it. Otherwise, you can give them most medications. As you can see, antihypertensive, phosphate binders, erythropoietin injection, insulin, and carbamazepine. What do you think? Stop the video, put down your answer, and think about it. I give you the facts already. Phosphate binders is going to decrease what? Phosphorus in the blood. So that's good to give it to the patient when they're going for dialysis. It helps with dialysis. Erythropoietin is going to increase red cells. It's not going to be affected by dialysis. Insulin, you don't want the patient to be hyperglycemic, therefore you can give it to them. And carbamazepine, you don't want them to have seizures, so they can have it. Antihypertensive, you should avoid it because it causes what? Hypertension. So key fact, anything that is going to cause hypertension, diuretics, water-soluble vitamins like vitamin B, C, and folic acid, you should avoid it. Antibiotic can also be cleared during dialysis, so they should avoid it. Any other medication, you can give it, but you got to check with the provider. But these are little ones that the NCLEX will ask you. Don't forget about antihypertensive, diuretic, and water-soluble medication. But most medications, especially renal failure medications, can be given. Phosphate binders, erythropoietin, insulin, and if they have seizures, you can still give them their carbamazepine. You don't want them to have seizures, otherwise they get into trouble. That's the key. So antihypertensive is the only answers. It's a select or apply. You just pick those that you're confident. Next question, which findings should the nurse prioritize? That means there's one medication you should pay attention to prioritize. A nurse is caring for a client, prescribe what? Bethanechol. Key fact, you have to understand what or know what is Bethanechol. If you know it, then what do you think? Bladder scan show 500 ml urine in the bladder. Client report difficulty initiating urination. Blood pressure of what? 100/60 and hypersalivation. This question, I want you to put your answer down. Let me know what you think, but it requires critical thinking. At the same time, common sense, and know the medication. It's a renal medication you're supposed to know, mostly for the bladder. Bethanechol. What do you think? The key fact is this is a cholinergic. We give it to people who have urinary retention. So cholinergic will cause the bladder to contract. Therefore, number one is a trap, right? Bladder scan shows 500 ml. That is the reason why we prescribe Bethanechol. Client report difficulty initiating urination. 1 and 2 are saying the same thing. That is the reason why we give them Bethanechol. Blood pressure of 100/60, Bethanechol, which is a cholinergic, will decrease your blood pressure, but this is normal. Hypersalivation is a side effect of a cholinergic effect. You have drooling associated with salivation, and that can affect your airway. So that's the key. Number 4 is your right answer. So Bethanechol stimulates parasympathetic nervous system, and all the signs and symptoms about cholinergic side effect is what you pay attention to. 1 and 2 is the reason why we prescribe the medication. Key fact. Next question, which client statement indicate a need for further teaching? That means they're saying something wrong. That's the buzzword, something wrong. So you have to know the concept and figure out if they're saying something wrong. A client with what? Acute urinary tract infection is a UTI. Is prescribed what? Phenazopyridine. That's the medication, phenoxyparidine. Therefore, these medication, phenoxyparidine, is the key aspect. If you know everything about it, then you can answer the question. The patient saying what? This medication maintains my urine a reddish-orange color. I will take this antibiotic for 7 days. I can stop taking the medication. Once my burning goes away, I should report my yellowing of skin or eyes to my provider. I give you 10 seconds. Put down your answer and let me think. Think about it. The medication is for Phenazopyridine. What do you think? Why do we prescribe it to patients who have UTI? This is a common medication. They like asking regarding renal pharmacology. It's good to know. What do you think? I know you put down your answer already. But the first thing you should know is this is not an antibiotic. Okay, this is not antibiotic. It's used for what? Analgesic, to help with the pain, the burning, sometimes the spasm, but mostly burning and the urgency and the frequency. So this is what the medication is used for. It's not an antibiotic. It will turn your urine reddish orange. That is normal. I will take this medication for 7 days. Antibiotic is wrong. It's not antibiotic. You can stop it if the burning goes away because it's a pain medication. If you don't need it, you don't need to take it out. And if your urine is changing color or your skin, this is liver toxicity, can have hepatotoxicity. Therefore, you have to do something about it. But the key aspect is not antibiotic. Always look for it. It's not antibiotic. It's what? Analgesic. Therefore, number 2 is your right answer. Which finding should the nurse prioritize reporting to the provider? That means something you see that you got to talk to the provider. Prioritization. Nurse is reviewing medication for a client with chronic recurrent UTI who is prescribed long-term Nitrofurantoin therapy. Forget about it. It's a long question. Rewrite it. Patient is on Nitrofurantoin therapy. Which one should I prioritize? I rewrote the question. Now I have control over the question. I need to prioritize a patient taking Nitrofurantoin. Which one do you think? Your urine turning yellow? Patient has headache, persistent cough, and nausea after taking the medication. Stop the video, 10 seconds, put down your answer choice, and let me know what you think. This medication you need to know is very important. Its side effect is very important because we use it for UTI, but it can cause major problem. What do you think? The right answer is not number 1. Turning your urine yellow is expected finding, right? Headache is one of the expected findings. They take some Tylenol to help with that. Persistent cough is a problem. Nausea is not the problem. But the major problem is persistent cough because it causes pulmonary fibrosis and interstitial lung disease. Therefore, that is your key. Anybody on Nitrofurantoin, look for cough, look for shortness of breath, look for dyspnea because those are bad side effects associated with the medication and we need to stop it. So number 3 is your right answer. Which instruction should the nurse include in the client teaching? That means you got to teach them. A nurse is caring for a client with recurrent UTI is prescribed Ciprofloxacin. Do you know this medication? You know it. This is an old medication, but sometimes they can use this medication in the test. Ciprofloxacin, I can tell you, is a fluoroquinolone. Therefore, I've given you a clue. It's a quinolone, fluoroquinolone. It's the same thing as ciprofloxacin. They are in the same group. If you know ciprofloxacin, then you can answer this question. Take this medication with milk to reduce stomach upset. Avoid prolonged sun exposure while taking this medication. Limit fluid intake to prevent renal irritation. Stop the medication if you experience mild nausea. The question says the nurse should include in the teaching. Therefore, what teaching do you provide? Forget about the name of the medication. Ciprofloxacin does not matter anymore. I told you what it is. It means it's a fluoroquinolone. What teaching do you provide for a patient taking fluoroquinolone? Milk should be avoided. They should not take it with milk or dairy products. So number 1 is gone. Right? You can't stop taking the medication if you have mild nausea. It's an expected finding. Right? You should avoid sun exposure because it makes you photosensitive. Therefore, you have rash on your skin. You should not limit your fluid because what? When you limit fluid, you can clear the urine. This is why you have UTI. Drink a lot of water and wash everything out. So the concept is ciprofloxacin is a chlorinol. Fluorochlorinol is an antibiotic for UTI. It causes photosensitivity. You should avoid milk, dairy product, antacid, and drink a lot of water to flush it out. Which intervention should the nurse prioritize? Prioritization 101. NS is caring for a client prescribed what? Propantheline bromide. Propantheline bromide for peptic ulcer disease who has a history of urinary tract infection. Which of these should you prioritize? Once again, circle the medication, propantheline bromide, and I need to prioritize for patient prescribed for what? Peptic ulcer disease who has urinary retention. Schedule the medication 30 minutes before meal and at bedtime. Instruct the client to increase fiber and fluid intake. Monitor for decreased gastric pain. Question the prescription. What do you think? 10 minutes. This is critical thinking. This pharmacology, renal pharmacology, questions and answers with the rationale, aspect rationale to let you think. When you see these questions again, you will never forget it. I yield fact for you. Think critically. The medication is what? Propantheline. You need to pay attention to giving to the patient for peptic ulcer. Patient has urinary retention. The key is what? You need to prioritize. If you have ulcer, hey, yeah, you take the medication 30 minutes before meal at bedtime, okay? Instruct the client to increase fiber. Why do I do that? It has nothing to do with peptic ulcer disease. This should tell you something. Monitor for decreased gastric pain. Well, you're taking medication to help with peptic ulcer, your pain will go down. Therefore, you can see 1 in 3 is gone. Now you're left with what? 2 and 4. Instruct the client to what? Increase fiber, prevent complication associated with the medication, and force a question the medication. That means there's something in the question that the patient should avoid. Critical thinking, you're analyzing each question and make sure they don't contradict each other and they're giving you a clue. 4 and 2 are giving you a clue. 1 is said, take care of it, treat the complication, and 4 said, don't give it to the patient at all. Key fact, that medication, propantheline, is what? Anticholinergic, which causes urinary retention and therefore it causes all side effects. The reason why you have to increase your fiber and fluid intake is because what? It's an anticholinergic. It causes constipation. So we don't want you to have constipation. Patient already have urinary retention. If you give them anticholinergic, they're going to go into bad urinary retention. Next, you question that order. Which finding required the highest priority intervention by the nurse? A client with what? Recurrent pyelonephritis is prescribed ciprofloxacin. It means you have recurrent bad UTI involving the kidney, not the bladder, the kidney itself, and have been prescribed ciprofloxacin, that is fluorochlorinol. You have to know the key fact about fluorochlorinol. This is the same thing at the previous question. What do you think? You should prioritize. Client report nausea when you take the medication. You report Achilles tendon pain when walking. Report dizziness after standing up quickly. Report metallic taste in the mouth. You got to be sharp. Think critically. Which of these problems I've listed is most important associated with fluoroquinolone? What do you think? Put down your answer. Stop the video. Let me think. We are doing a test. You are part of it. I want to know. We've answered 7 questions. How many do you guys so far? 5 out of 5, 6 out of 6, 7 out of 7. This is the 7th question. Put down your answer. Let's think. Number 1, fluoroquinolone. Key fact you have to know about them. Avoid what? Dairy product. Avoid what? Milk. There is a black box warning about tendon rupture, right? It also causes photosensitivity. You got it. That's the concept. Every time you see a fluoroquinolone, that's what you're going to use to answer the question. Therefore, what is the key? Tendon rupture is the most important. Achilles tendon, I should worry about it. If you take the medication, you have nausea, it's fine. Dizziness, orthostatic, just get up slowly. Metallic taste is an expected finding. Therefore, this is what you need to pay attention to. A nurse is providing discharge teaching to a client prescribed what? prescribe trimethoprim sulfametazole for UTI? Which client statement indicate a need for further teaching? You've seen this medication before on pharmacology regarding antibiotic. Same thing, same strategy. It doesn't change. It has the same name. Therefore, it's a sulfur drug. We use it for what? UTI. What do you think? Drink a lot of water, 8 glasses of water a day. Let the doctor know when you see rash. I will limit my time in the sun and use sunscreen. Take the medication with what? Orange juice every morning. Think about it. When you answer questions, don't rush. Read the question again. Patient taking some sulfur drugs, some sulfonamide for what? UTI. Which client statement need further teaching? Well, drinking a lot of water is good when you have UTI. Letting the doctor know that you have a rash is also very important. Do you put sunscreen on yourself, or do you take the medication with the orange juice? Test taking strategy. Sulfur drug, I know about them. You should know the side effect. Patient is taking this medication. You need further teaching. Look at the answers. 2 and 3 are saying the same thing. I wear sunscreen and I say rash. Something should tell you that there's some photosensitivity associated with this medication. Therefore, 2 and 3 are okay. But one said drink water, another one said drink orange juice. Which one do you think is? One said, I would drink a lot of water. The other one said orange juice. You can't drink water and then drink orange juice at the same time. Something is wrong. The key is you should not drink orange juice because orange juice will make the sulfur drug crystallize and it form more kidney stone. Therefore, 4 is the right answer. The key fact is sulfonamide, you should drink it with a full glass of water. Take it with a full glass of water, not orange juice, because then it will crystallize and it cause problem. And next is reviewing home medications for a client with end-stage renal disease. Which over-the-counter drug require immediate teaching? Look, kidney disease, there's one medication you should avoid. This is a bonus question, and you should see that NSAID, a bad problem, does not require you to be taking this while you have end-stage disease. You should avoid it. You should avoid it. You should avoid it. This is a bonus one. The client with chronic kidney disease is prescribed calcium carbonate. What is the expected therapeutic effect? Prevent cardiac arrhythmia, improve your urine output, reduces potassium level, and bind dietary phosphorus. When it comes to kidney problem, any problem they have, we try to counteract it. First, they have high potassium, so we give you things to lower your potassium. Their phosphorus is high, we give you things to lower it. The calcium is low, we give you things to offset it. The reason why we give you calcium carbonate is what? Do we giving it to you to decrease your cardiac arrhythmia or improving your urine output or reducing your potassium or binding your dietary phosphorus? Don't pick potassium. When I give you calcium carbonate because your potassium is high, it's to protect your heart, not to decrease your potassium. It does not decrease your potassium. When in chronic kidney disease, your calcium is what? Low, and your phosphorus is high. So what we do, we give you more calcium to counteract the effect of phosphorus. So it's a binder. We're not preventing cardiac arrhythmia. It does not affect your urine output. It's exchanged with phosphorus. So the right answer is that it's a calcium, it's a phosphorus binder, and get rid of your phosphorus. That's the key. And it's reinforcing this dietary teaching for a client taking phosphorus binders. Which meal choice indicate correct understanding? Phosphorus binders is going to bind things in your GI tract to prevent you from absorbing what? Phosphorus. Therefore, which diet meal choice do you think you should be taking? Well, if I'm giving you phosphorus binders, you should not be taking too much food that has high phosphorus. That's the key. Which one you know? Cheeseburger with mixtures, fried fish with coleslaw, baked chicken with rice and green beans, pizza with extra cheese. These are hard questions, but think about it. If you don't know, the concept is this. This is the concept. I need you to memorize this and know them. Fresh fruits, vegetables, chicken, lean meat, egg white, and rice and pasta are the key things that when you're talking about kidney disease patient, this is what you give them because you don't want them to have high phosphorus. So the right answer is number 3. All other choices are wrong. But the best way to answer these kind of phosphorus high-level medications or diet is to know these are put on the screen. Fresh fruits, vegetable, chicken, turkey, lean beef, egg white, not the yolk, rice and pasta. And you can educate the patient. So any other option they give you, don't pick it. Know this one and say, this is what I will give you to a patient with kidney disease. Any others, I just avoid it. 11 questions. What is your score? Put down in the comment and tell me you're ready. Type, I'm ready. Type, I'm ready. I've got 11 out of 11. That's the key. 4 more. And next is reviewing intake orders for a client with end-stage disease. Which medication should the next question? Patient has end-stage disease. What should you avoid? Morphine, acetaminophen, and gentamicin, erythropoietin. What do you think? Put down in your answer choice. Comment and explain to me why you pick whichever. Patient with kidney disease should get pain medication. Nothing wrong with it. Acetaminophen affects your liver, not your kidney. Gentamicin is nephrotoxic. And any patient with end-stage disease, we give them erythropoietin to improve their red cells. Therefore, 3 is the right one. A client with chronic kidney disease is prescribed Sevelamer. Which teaching is correct? Take this medication on empty stomach. Take this medication with meal. This medication increases calcium absorption. This medication replaces potassium. This is the same thing that we saw, but I changed the name of the medication just to trap you. Sevelamer is what? A phosphorus binder. If I give you a phosphorus binder, what would you do? Think about it. Take this medication on empty stomach. The phosphorus binder, if you eat food, is supposed to absorb phosphorus from your diet. So you should take it with food. Take this medication with meal. Makes sense, right? This medication increases calcium absorption. It does not increase calcium absorption. It binds to phosphorus, and it may indirectly increase calcium, but not absorption. This medication replaces potassium. It does not. Therefore, the right answer is a phosphorus binder. You should take it with food, and that's what you teach the patient. And next is caring for a client receiving erythropoietin, a good medication to know because it's very testable. A broad effect is used in kidney disease, which finding required the nurse to withhold erythropoietin or epoetin alpha and notify the provider. There's a concept you have to know about this medication. Hematocrit of 32%, hemoglobin of 11, headache, and blood pressure of 140/70. These medications are used to increase your blood cells. The major side effect is hypertension. If your blood pressure increase, you get headache. So the major side effect is headache. Hematocrit is not that high. If it's like over 40, yeah, we don't even let you get there. But after 35, we stop it. Hemoglobin, if you're greater than 11, we stop it. This blood pressure is not bad. Therefore, headache is the major side effect. So erythropoietin, early toxic sign is headache. Then you have hypertension. So that's when you hold the medication if your hemoglobin greater than 11. Last question. Client with hyperkalemia is prescribed sodium polystyrene sulfonate, KSLate. Which intervention should the nurse include? Select or apply. You have to know this medication. They're not going to give you KSLate. They will give you sodium polystyrene sulfonate. What do you think? It's also what? Used to decrease potassium. But there's a way it does that. It's given orally, and you have to have diarrhea. But the diarrhea, we got to titrate it and see how much. If you cannot have bowel movement, you cannot take it. Because it's a what? It's a sodium polystyrene sulfonate. You see the sodium there is going to exchange with potassium. So I decrease your potassium and I increase your phosphorus. Therefore, what are you going to do? We need to monitor your what? Bowel movement. We need to check your potassium. We need to check your sodium. Antacid is going to affect it. Access for constipation and diarrhea, because if you have constipation, you can have necrosis. Therefore, what are the right answer? Monitor for bowel movement, monitor for hypokalemia. You should check the individual sodium level, and then you should assess for constipation and diarrhea. If they have a constipation, that means you should stop the medication. These are the concepts you have to know. 12 medication, 15 question, pharmacology, practice test 11, questions and answers, critical thinking, answering this medication to pass for your school, nursing school, and NCLEX. Thank you for watching. If you like this video, follow the series, put in the comment what other medication you want to know. Take care of yourself and bye.